my name is Jenny and this is Pansy and we are your instructor at American Dental and Medical Institute. We're going to help you with your radiation safety course, coronal polishing and infection control. And we're going to practice a lot about dental instrument and other stuff and we will help you to get to your RDA.
Including, we are going to be mixing materials, taking alginate impressions on each other, and learning how to form models, which is going to be very essential for you when you are in the dental working field.
Today, we're gonna learn about coronal polishing. There are a couple requirements. There is only 3 requirements. First, patient should be 6 years and above, no braces. And third one is that minimum training tooth present. Today, me and Pansy gonna demonstrate that when you bring your patient, what we expect you to follow. So here we go, and you will see us. You want me to sign? Sure.
So the first thing you're going to do is when you bring your patients, you're going to ask that your patients stay out into the car and come about 5 to 10 minutes before their appointment. Only one patient per your appointment time. And when they come in, when you assist them and you ask them to come in, they're first going to come in and we're going to have you sign in, and then you're going to give us your patient packet information, which is going to be this. It needs to be all filled out. You need to sign them and the patient needs to sign it. Once you hand it to me or your instructor, Jenny, we will go ahead and start reviewing it and asking any medical questions to your patient while you are starting to gear up. So now at this point, Jenny, your instructor, is going to be my patient. I am going to gear up and show you the proper way to how to bring back your patient. First, want to make sure you have your gown on because it's very important, because this is part of infection control, as you guys should remember. Do not put on your gloves until you're actually in the operative room. You will then don your mask and your face goggles. You will bring your patient. Okay, I'm ready. Come on back. Thank you. You will first have your patient come over to the wash basin. You're going to ask that they go ahead and rinse with the mouth rinse. Can you go ahead and please have a rinse? Then you will provide them with a disclosing agent tab. You will ask them to go ahead and chew on this for about 30 seconds. Swish it all around your mouth. Provide them with a napkin so that they can, after they spit back into their cup, they can wipe their mouth and put it down and then dispose of it.
All right, and Pansy, why we are using the disclosing agents in the coronal polishing class?
The reason that we would be using the disclosing agent is so that you can see any plaque that is on the teeth and the areas that you need to focus when you are performing your coronal polish.
Got it, thank you. All right, and can I see your teeth, please? If you notice here, the teeth are, there is disclosing agent 2 colors, pink or purple. And you see it's turning to purple, and we ask the patient to spit in the same cup that they rinse with, and then after that, we put the napkin on top to prevent contamination as much as possible. And can we see the teeth again? And you see, like, this is indication where the plaque is located, and that's the purpose of the coronal polishing class, to remove them. All right. And Jenny, I know you're a patient today, but yes. What recommendation you will give to the students before they start, when they sit their patients on the chair here?
So you educate your patient tell them why you are giving them this tablet. You know, you tell them that this is what you are planning to do on patients, so you relax them. Now everything will be ready. You show them. Give them the mirror, you show them that look at this is what we're gonna clean today, and you know, make them comfortable so they are not nervous. And then everything, before your patient comes to your operatory, make sure everything is set up so you don't take too much time.
Thank you. And Jenny, by the time
Yes.
Patsy getting ready, what instruments and what material, what we need to have on the tray for coronal polish beside the slow speed?
So this is your slow speed. This is your prophy cup. You're gonna put it here and lock it. Now this is your suction, slow speed suction. This is your high speed. This is your water pick. You're gonna keep it here. This is your mirror, and this is very important. Before you start your patient, make sure me, Pansy, or Dr. D check your patient, and you know, after we give you approval, you start.
Excellent.
And we will give you polishing
Prophy paste, exactly. All right, and we always, this is another important.
This is very important. You always protect your eye and patient's eye. While polishing, it might go in your eye or patient's eye, any prophy paste, so splatter or anything. So please always protect your patient's eye.
Because most of our students, almost all of them, they got the infection control course, and they know very well saliva. It's not only red, it's all contaminated as well. So we're doing this PPE and all the infection control measure to protect ourselves from contamination among staff, among patient, and instruments, and prevent to take this basically home.
And this is a great way to practice your infection control, because once you're done with this patient, you know, I want you to clean your dental chair, put everything away. So this is a great way to practice your infection control course too. Like we will see that.
Got it. And any other tips that you want to add basically on how to do effective and good corneal polishing to our students? Any tips that you can give for them dealing with the slow speed and the prophy angle? Can you show us how to get that, or maybe Pansy can take over on this part? As you see here, the slow speed is considered of two parts. One is the motor, which is connected to the
Motor.
and we leave that on the unit all the time, and we do cold sterile on it. And Pansy will go with details, and especially with your practice on mannequins today. So the part that goes on top of the slow speed is, if you see it snaps in there, and you're gonna see right now very important how we put the prophy angle and lock it in place.
You're going to follow this opening. There's a little notch right here on the angle. Make sure it goes right in and it snaps down. Some will have little locking devices that you would go ahead and lock it. As you see, I just twisted it. The reason for that is so that when you do go ahead and use your foot pedal, your handpiece does not rotate. If it does rotate, then that is an example of it not being correctly locked.
Got it.
So once you are all set up, you are masked, you are wearing your own glove, your own goggles, or if you do not wear glasses, make sure you are in goggles or a face shield. The reason why, as Instructor Jenny had mentioned, there's a lot of saliva splatter. You
Excellent.
then go ahead and place the bib on your patient. I'm gonna go ahead and place this on you. Like lean your head forward for me.
And Pansy, any tips how we start from which teeth? Are we go from 116 facial and go down 1732?
Yes.
And then we have 5 surfaces of the teeth. And what's your recommendation to the students where to start and where to finish? And I want to ask later on Jenny on her experience doing this on daily basis in your office.
Perfect. So right now, as I'm still preparing, I'm putting the saliva ejector and the HVE. That way I can go ahead and keep my patient's mouth pretty much dry. So when you are going to start, my preference, and which I find is the most easiest, is that you are going to start buccally, most posterior on tooth number 2, the right side, the upper right. I continue from the upper right, I go completely around to 17, if 17 is present. 16, I'm sorry. And then I drop down, I drop lingually, and I come back around to the right side. Then I drop to the mandibular, 32, if 32 is present, and going back around to
Facial.
17, facially.
Got it.
And
So
then lingually, and then I do occlusal.
Excellent. Okay, let's repeat that because this is very important for the students to
And
follow.
I'm going to mimic as
Yes.
I have it. Okay?
Perfect.
So I'm going to show you how I would do it. Can you go ahead and rest your head back? Most important thing is I want to see your guys' posture also. It's very important that you adjust your patient's chair, you tilt them back, and you should be able to sit straight, and you should, no elbows out, they should be down, relaxed by your side. This way you don't hurt your elbows or your wrist. It's very important. You're gonna be in this field for a very long time.
Got it. And Pansy, sorry to interrupt, but how we can adjust this using the foot pedal, which is, you can see it right there.
You can see right here, and some will have on the chair. It's always easier with the foot pedal. So if you need to lift up the patient, you go up. Very simple. Then you want to lay the patient back. You see right here's the head. You're going to just lay the patient back.
Excellent.
I usually like to start about this angle, and I'm going to bring the patient down to me. You're going to make sure you have your mouth mirror. Because my patient is wearing glasses, I will ask her, would you like to wear your own glasses or goggles?
I'm good with my
You're good?
glasses. Thank
Okay.
you, Pansy.
You're welcome. So then, once I start, make sure you do not have the light shining into their eye because it can be very irritating. So I'm going to ask them to go ahead and turn their head slightly towards me, please. Or actually, can you look away from me a little bit? Can you go ahead and open? I then use my pinky as a retractor, and most important, fulcrum. This is going to help you control your handpiece. Okay, so when I come in, now I'm going to have her look a little bit. I keep on adjusting her until I can see perfectly without bending. But if I need to bend over a little bit, I can. You see, I get into my patient. I go ahead and start here.
So as you see here, patient is seated in a good position. Hands and the operator, in this case Pansy, in a great position as well. And now she's starting from, as you remember from the dental anatomy, from the upper right quadrant, tooth number 1 facial and or 2 in, if it's missing, and she's moving all the way with, and you need to control the pressure. One of the tips as a dentist, I will recommend to everyone that doing corneal polishing, not to apply too much pressure and not to be on the tooth for too long. The time that we recommend, Pansy, how long it will be? Couple seconds.
Few seconds, and it should be low RN and light pressure.
And you can control this with the foot pedal.
Foot pedal. Once you are hitting the foot pedal, you'll be
Because
able to.
this is a rubber.
You can, maintain that speed from your slow speed. Some motor, some hand
here. Some will be here that you can adjust the speed. Some automatically, it doesn't matter how much you push, it would not rotate.
Correct.
And there will be some that you do have to manually control with your foot. So
That's correct. So remember, because this generates heat while you're doing this, and this might turn to emergency if it's applied for too long. And one of the emergencies that I heard and I witnessed in the past, as well as my staff, is overheating and leading to endo treatment in the past. So we don't want to see this. We're going to practice a lot on mannequins before we see our patients, and our instructors will be around you. All right, Nancy, let's go and start the coronal polish in here. We're doing demo right now.
So the proper way would be to have your room already set up. Make sure everything's ready. Flush your water line. Make sure all that's out because we want the biofilm and everything that has been sitting to come out. Once your patient is set up, you're going to have one of your instructors come in. We're going to go ahead and do a quick mouth mirror inspection and see, and then you are going to start your coronal polishing. We are going to pretend that this right now is my prophy paste. And once I have my patient set up in a comfortable position for me and as well as the patient, because remember, you might need to adjust their headrest, they might have some neck issues or whatnot, so you want to also make sure that the patient is comfortable in the chair. Once we get ready to start, you are only going to start with about 2 to 3 teeth, and then you're going to make sure you're adding prophy paste again. Another tip of what you can do is you can remove some of the prophy paste, which I do in my own clinics, is I remove out my prophy paste. I section it into into 4 sections, and then I take half of each one per each quadrant and side. So I separated my prophy paste. Go ahead and open. I go ahead and I apply it already to the teeth. I make sure I get it in proximally. I get it all nice and in there. Once it's in there, that just prevents me from needing to keep on dapping, but you can. Then once I start, I go ahead and start with the most posterior tooth, whatever tooth is present, 1, 2, or 3, and then I start. And what I start is I start distally, and I go in a U shape. So I go around parallel with the gingival. This way I avoid touching or injuring her gum line. And
excellent. So I'm sorry, one of the important things is to stay away from the gum line, because this rubber will turning even with slow speed around the gums, that might turn that create like soft tissue burn, and that's very, very painful. It might turn to blister and will end up with very bad experience. So we're staying away from the soft tissue. When we're retracting the cheek, we're asking the patient to open and close just to get a good view. And remember, do not polish if you don't see the tooth. Do not do blinded, you can't do that. You have to work on the facial surface of the enamel that you see, how you see right now, away from the soft tissue, and using the mouth mirror or your fingers in order for you to retract the cheek. And make sure, don't push it too hard, because that's another pain that you might cause to the patient, and that's bad experience and complain later on to the doctor, or bad review to the office. So be very careful on how you, and we're not turning on the motor right now just to prevent the noise, so you can hear the conversation that's going on. And as you see this U-shaped movement, very careful around the gum line to prevent any damage or any problem, and not more than 2 or 3 seconds.
And if you see, I'm sorry, didn't
go ahead, please.
You see, if you can come in closer, you'll see what I'm doing. So now, as I'm getting closer to her midline, I am rotating myself around. So I have better access. Now with my finger, I am just pulling her finger up. I'm asking her to look up. I will adjust my my light. And then when I come, I'm focusing on her chin, and I'm gonna come up again, most distally, coming around to the gingival without touching it, and coming down measly, and then swiping down the center.
Excellent.
You might have to a couple times depending on the size of the tooth. Every patient has different sizes, so you want to make sure you're getting all of the surfaces. So again, I'm going to show you. I'm coming up, I'm going down, and down, and down.
And can we go a little more about the fulcrum, please, Nancy? This is very important. Always we have questions on this. where we do it, where we put our finger, how much we can push.
So make sure you're using the pin. You're holding it,
This
not
is
like a
how-
pencil.
Exactly.
You want to have a supported pin, okay? And remember, you will have to be rotating your handpiece and your hand wherever and whatever side you're doing. So when the patient, I'm gonna lower you down a little bit more. When we are here, I like to rest my 3 fingers underneath her chin, and I'm resting right here. I'm cupping her head, holding it. Can you turn towards me? I'm gently pulling up her lip so I can see her entire tooth and making sure I can see the light. If they're trying to open so wide at this point, you could ask them, go ahead and relax. Why? Because their jaw is going to get very tired. So make sure they're not overstraining themselves. So I'm going to pull up her lip, and you can either fulcrum next to the tooth, how some people like. You can, on the lower, try to avoid soft tissue, or I like to hold down onto the chin. This is the most stable for me. And I come and I'm holding it here. I'm using my pinky, and look it, I'm not slipping. My arm is rested down to me. I have full control. And if you look at the cup up against her tooth, your cup should only flare out about that much. If you see it like this, you are actually going to hurt the patient and hurt the enamel. You're gonna break, it's gonna stop, and so you'll be able to see. It should be a light flare, and you're coming right up and around. As you see, I'm not touching her gums, but I'm going right where I need to be. And then I'm coming to the center.
And this is a great demo. Thank you so much. And later on, and after we complete the polish, basically very carefully you remove the disposables, take it to the dirty area, which we're gonna go over in details with the practice today with the mannequins. Thank you so much, both Jenny and Pansy, for this great introduction for coronal polishing.
I can't wait.
I can't
It's gonna be awesome.
Thanks a lot.